My name is Dr. John Stone. I'm a rheumatologist at the Massachusetts General Hospital in Boston and a professor of medicine at Harvard Medical School.
My name is Dr. Shona Quinn. I'm a clinical scientist at Zenas Biopharma. In this video, Dr. Stone and I will discuss head and neck IgG4-RD. It is thought to be the second most affected side of the body after the pancreas. When I was studying immunology at Trinity College in Dublin, Ireland, IgG4-RD was not part of the curriculum as it was not a well-known disease. In fact, they recognized it by many different diseases, including Mikulicz disease, Kuttner's tumor, and Rigel thyroiditis. In the early 2000s, we realized that all of these different diseases have the same characteristics and needed a similar approach for treatment. As Dr. Stone has previously said, we have come a long way to understanding IgG4-RD, but we still have a long way to go. About 10 years ago, scientists from Canada studied which patients get head and neck IgG4-RD. This work is still important for doctors who treat your disease to be familiar with. The Canadian investigators examined data from 43 groups around the world, encompassing about 500 patients with IgG4-RD involving the head and neck regions. The investigators found that patients with IgG4-RD involving the head and neck hailed from every corner of the globe. This was a very important finding, illustrating that IgG4-RD can affect individuals from any country and persons from any race. Approximately half of the patients described in the Canadian study were male and half were female. The average age was about 60 years old, but the span of ages covered by the patients in the study ranged from young children to the very elderly. Half of the 500 patients had lesions in orbits, which is defined as the region around the eyes. The organs that are included in the orbital region are the lacrimal glands, which produce tears, the muscles that move around the eye, the so-called extraocular muscles, and the optic nerve, which carries the vision signals from the eyes to the brain. The major salivary glands are also affected very commonly in IgG4-RD. About a quarter of the 500 patients had lesions in the salivary glands, which include the submandibular glands and the parotid glands. The salivary glands, as their name suggests, produce saliva that bathes the mouth and helps begin the process of food digestion. Let's describe the location of these glands a bit better. The most characteristic salivary gland affected by IgG4-RD are the submandibular glands. These glands, when enlarged as they are in IgG4-RD, are easy to palpate just under both sides of the jaw. The next most commonly affected salivary gland affected are the parotid gland, which are located in front of the ears on both sides of the head. Finally, involvement of the sublingual glands located beneath the tongue is usually the least prominent of the major salivary glands. As noted, the purpose of the salivary glands is to produce saliva in response to food when one begins to eat. About 50 of the 500 patients had lesions in the thyroid gland. The thyroid gland is the organ near the Adam's apple that produces hormones that helps the body regulate energy usage. One pattern that is apparent in the description of head and neck disease in IgG4-RD is that the IgG4-RD tends to involve glands, which are organs that produce hormones. The pancreas, which we discussed in an earlier video, is an important gland that makes the hormone insulin, among others. In the head and neck region alone, we've already mentioned that IgG4-RD can affect the lacrimal glands, submandibular glands, parotid glands, and the thyroid gland. IgG4-RD can also involve the pituitary gland, a small gland situated in the middle of the head just at the base of the brain. At this time, no one knows why IgG4-RD has such a tendency to affect glands. Up next, Dr. Stone will discuss symptoms and diagnosis.
Thank you, Dr. Quinn. I'm always surprised by how many organs can be affected by IgG4-related disease. And the symptoms of IgG4-related disease vary greatly depending on what specific organ or organs are affected. Two patients with IgG4-related disease in my clinic might have very different experiences depending on their distribution and degree of organ involvement. One feature that many organs share when affected by IgG4-related disease is that they become enlarged. This is because of the infiltration of inflammatory cells into the affected organs. Let's start with the orbit. The lacrimal glands are located over the upper outer portion of both eyes. Inflammation in these glands causes them to swell, often leading to easily noticeable masses where the lacrimal glands are located. Sometimes the swelling in the gland is so significant that the patient has difficulty opening the eye completely, and it may be suspected of having an infection. Sometimes, if the inflammation has damaged the function of the lacrimal gland, the glands no longer produce normal quantities of tears, and the patient experiences significant dryness of the eyes. Moving on to other very important structures within the orbit, we come to the extraocular muscles. These muscles insert into the tissue of the eyeball at several locations around the eye. Their coordinated work permits us to move our eyes in a coordinated function in all directions through our fields of vision. When affected by IgG4-related disease, the extraocular muscles can become thickened and scarred, interfering with their normal function. This can lead to diplopia, or double vision, when the patient gazes in certain directions. Swelling of the extraocular muscles also leads to proptosis, or the appearance that one or both eyes is protruding prominently, leading to an abnormal appearance. Finally, and potentially the most severe consequence of orbital IgG4-related disease is damage to the optic nerve. As Dr. Quinn observed, the optic nerve carries vision signals from the back of the eye, the retina, to visual pathways in the brain which interpret what the eye has seen. Sometimes in IgG4-related disease, an inflammatory mass located behind the eye can compress the optic nerve, leading to damage and impairment of vision in that eye. IgG4-related disease in the major salivary glands is marked again by the development of mass lesions in these organs, leading to noticeable bulges below the jaw in the case of the submandibular glands, or on the sides of the head in the case of the parotid gland. It's typical of IgG4-related disease to involve both submandibular glands and both parotid glands in a symmetrical manner, meaning on both sides of the face. Swelling within the major salivary glands is generally painless. Doctors frequently decide, however, that biopsy of a mass within a gland or of a diffusely enlarged organ is important to exclude the possibility of cancer. Lymphomas, for example, sometimes present with swelling of the salivary glands too. Biopsy of the salivary glands is generally an excellent way to confirm the diagnosis of IgG4-related disease while excluding lymphoma or other conditions that can mimic IgG4-related disease. The major consequence of major salivary gland involvement in IgG4-related disease, not surprisingly, is dryness of the mouth. Because a normal salivary pool is important for oral health, impaired salivary gland function often leads to a predisposition to the development of tooth cavities. Finally, the thyroid gland. Patients with thyroid gland involvement, known for more than 100 years as Riedel's thyroiditis, before it was recognized to be part of IgG4-related disease, develop a hard, nearly rock-like swelling in the front of the neck. IgG4-related disease of the thyroid gland can cause significant problems because of local extension of the inflammatory process to the trachea, the airway, or the windpipe, local nerves, and other nearby structures. Many patients with IgG4-related disease involving the thyroid gland have to undergo surgery to remove the enlarged thyroid. If the entire thyroid is removed, then patients need to take a pill every day to replace the hormone normally produced by the gland. I'm happy to say that the great majority of patients with head and neck IgG4-related disease are controlled with a pill taken by mouth called a corticosteroid or steroid. Steroids are powerful medicines that unfortunately have potentially bad side effects in many patients. I like to use steroids at full strength for 2 to 4 weeks at the start of therapy, and then to taper it off over the next few months in the interest of controlling IgG4-related disease while hoping to avoid significant side effects. We'll discuss the use of steroids in a separate video. If the use of steroids doesn't lead to a long-standing disease remission, we do have other treatment options. Surgery is sometimes necessary, but this is generally needed only for a small number of patients with thyroid disease. Treatment with medications is very much preferred for other types of IgG4-related disease affecting the head and neck. The goal of treatment with medications is to reduce the swelling of enlarged organs, restore normal function, and prevent long-term damage. As a side note, your doctor might recommend watchful waiting or no drug treatment at all if your symptoms are mild and tolerable. Time itself may resolve IgG4-related disease in a small number of patients, but for most patients, a course of treatment with a medical therapy is appropriate. Even though IgG4-related disease has been known as a unique disease entity for only a couple of decades, we've already made good progress in treating the disease, and there are effective medications that can improve your condition. Right now, we don't have a cure for the disease, and the disease often returns after successful treatment. Nevertheless, we are getting better at managing IgG4-related disease over the long term. Many patients achieve long-standing disease remissions on and often off treatment following a course of therapy. I feel confident that you too can and will achieve good control of your IgG4-related disease. Close collaboration between the clinician and the patient is essential to achieving good outcomes and living well with IgG4-related disease. In this video, we focused on head and neck IgG4-related disease. We have now addressed the issue of the pancreas and the organs of the head and neck. In future videos, we'll cover other sites of organ involvement and discuss what future advances in medicine might bring to IgG4-related disease. Please refer to the links in our video description for a list of patient advocacy groups, clinical trials studying new therapies, and other patient resources. Thank you for watching, and I hope to talk to you again soon.